Morning high blood sugar can feel unfair. You went to bed without dessert, yet the meter looks worse after sleep. That does not always mean dinner ruined your number. Morning highs usually come from timing, hormones, sleep, medication, or the meal before bed. The repeated pattern matters more than any single scary reading, so your next step is not panic, it is pattern. A fasting number is not a simple food receipt. Sometimes it reflects dinner, especially after a late large meal. Sometimes it reflects what your body did while you slept. The safer first move is to separate the source before choosing a fix. Your body is not closed for business overnight. Your liver can release stored sugar while you sleep. Food, hormones, medicine, sleep, and stress can leave similar fasting results. The wrong answer can make the next morning worse. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Here is the basic mechanism. Insulin is the hormone that helps move glucose from blood into cells. Glucose means blood sugar in this discussion. Overnight, insulin levels may be lower, food is absent, and other hormones can push the liver to release glucose. Reason 1 is the dawn phenomenon. That means an early morning rise in blood sugar before breakfast. Wake-up hormones prepare your body to get moving. With diabetes or insulin resistance, that rise can be harder to handle. Insulin resistance means cells respond weakly to that hormone. A careful evening can still produce a high morning number. The meal may be innocent while the liver releases glucose near dawn. The next step is not self-blame. Check the overnight pattern before blaming willpower. Reason 2 is food that is still being absorbed. A large late dinner can keep glucose entering the blood for hours. Fatty meals can also slow how fast your stomach empties. That can delay the rise, so the meter looks worse the next morning. This is common after pizza, fried foods, desserts, or heavy restaurant meals. The issue is not only sugar, it is the combination of starch, fat, portion size, and late timing. Skipping dessert does not prove dinner was harmless. A huge late meal may matter more than a small sweet. Reason 3 is medication timing, dose, or medication effect. Some medicines wear off before morning. Some insulin plans do not cover the full night. Steroids are anti-inflammatory medicines used for allergies, pain, or lung problems. They can raise blood sugar for hours or days. That is why randomly increasing nighttime medicine can be risky. It might help a dawn rise. It might also worsen an overnight low. If you use insulin or sulfonylureas, ask your clinician before changing doses. Sulfonylureas are pills that can make the pancreas release insulin. Reason 4 is poor sleep. Sleep loss can raise stress hormones and make insulin work less effectively. Snoring, gasping, or daytime sleepiness can point towards sleep apnea. Sleep apnea means breathing repeatedly pauses during sleep. A careful dinner may still lose to a broken night. This reason is easy to ignore because it does not look like a diabetes choice. You may eat carefully and still wake up high. If sleep is broken, the body may spend the night in a stress state. Morning glucose can reflect that stress. Reason 5 is stress, illness, dehydration, or alcohol. Stress hormones can tell the liver to release more glucose. Illness can do the same, even before you feel very sick. Dehydration can make glucose appear more concentrated in the bloodstream. Alcohol can be confusing because it can push numbers in different directions. As the liver processes alcohol, it may reduce making new glucose, a process called gluconeogenesis. That can lower sugar in some people. Later, poor sleep, late food, dehydration, or stress hormones can push the morning number higher. One morning, reading cannot show the overnight path. A high fasting number may follow high sugar all night. It may follow a low overnight number that rises again. It may also rise only near dawn. Each path needs a different response. The low then high pattern is like a thermostat overcorrecting. Blood sugar drops too low, then the body releases hormones that push it up. This is sometimes called the Somogyi effect. It is considered less common than dawn phenomenon, but it matters for people using insulin or medicines that can cause lows. Stop asking only, how do I lower tomorrow morning's number? A better question is, what happened between bedtime and wake up? First, find the overnight pattern. A bedtime reading, a wake-up reading, and sometimes an overnight check can separate the causes. A continuous glucose monitor can help here. It is a wearable sensor that tracks glucose through the day and night. Without one, some clinicians ask for a middle-of-the-night fingerstick blood sugar test for a few nights. Do that only if your care team recommends it. Check the measurement itself before interpreting a surprising fingerstick result. Sugar on the skin can falsely raise the number. The strip can react to sugar from your skin, not only the blood. Old strips or a rushed test can also mislead you. Also notice what happens before the test. Brushing your teeth does not add sugar, but sweetened drinks do. Black coffee has no sugar, yet caffeine can raise some people's glucose. Testing before coffee removes caffeine as a variable. Keep the testing time similar. A number at 5:30 may not mean the same thing as a number at 8:30. Sleep, movement, coffee, or stress can change the comparison. Similar timing makes the pattern easier to trust. Start with the bedtime number. If glucose is already high at bedtime, the morning problem probably started before sleep. Look at dinner portion, late snacks, missed medicine, or evening activity. The fix usually begins earlier than midnight. Next, look at the overnight direction. If glucose falls low and then rises, medication safety must be reviewed. If it stays steady, then rises near morning, dawn phenomenon becomes more likely. If it stays high all night, overall evening control may be the issue. Then look at the weekly pattern. One bad morning after a party, illness, or restaurant meal is information. A repeated pattern on ordinary days deserves attention. Write down unusual days, poor sleep, alcohol, or stress beside the number. Bring the log to your clinician if morning highs keep returning. Do not compare your fasting number to someone else's target. Some people need tighter goals, and others need safer goals. Age, pregnancy, kidney disease, low blood sugar risk, and medication type change the target. Your clinician sets the target, not a comment section. You can also test practical habits. Move dinner earlier when possible. Keep late snacks smaller and higher in protein or fiber. Take a short walk after dinner if it is safe for you. Change one habit at a time, or you will not know which one helped. After the morning reading, breakfast can add one more clue. Skipping it helps some people, but raises later blood sugar in others. A balanced breakfast with protein and fiber may reduce the next spike. The best choice is the one your meter or sensor confirms repeatedly. The goal is not to chase a perfect fasting number every day. The goal is to identify the pattern that keeps returning. Morning highs can come from dawn hormones, late digestion, medicine effects, sleep problems, or stress. One number is a clue, not a verdict. Do not punish yourself for a number your overnight pattern created. The memorable rule is this: treat the pattern, not the panic. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.